before you start any sort of cardiovascular activity, you should always check with your doctor and make sure that that's safe, especially if you have a cardiac or pulmonary condition. So always start there. And then when you're going to start this cardiovascular activity or lifting, start with something that's comfortable for you. It's okay to feel soreness or shortness of breath. When you start feeling chest pain or dizziness, that's a good sign to stop. And when you feel a sharp shooting pain, that's something that's different from muscle fatigue or soreness, that's a good time to stop as well. One of the kind of rules or guidelines that I set for my patients, this includes patients that are just returning to an activity or patients that are post-operative that have had surgery that are returning to lifting or something like that, is I try to go by the 10% rule. Is start something very controlled and something that feels comfortable for you, and increase it at about 10% per week. You don't want to go 0 to 100%, and that's how injuries happen. And I see things like pec ruptures in bench press or distal biceps ruptures. I had an Achilles tendon rupture from jump roping and running and things like that. So in addition to kind of slowly ramping up, you want to make sure that you do a good warm-up and stretch and a dynamic warm-up. Yeah, you should always incorporate rest days into your training. You never want to do the same. If you're lifting weights, you don't want to lift the same body part 2 days in a row. And it's usually a good idea to take a day or two off between running days and things like that to give your body a chance to recover.